My name is Stephanie White, and I am a certified nurse midwife at the Community Health Center in Lubbock, Texas. I've been working here for about 8 years now, and then prior to that was a labor and delivery nurse. And I have been working with the people that are in the West Texas community and the surrounding areas since about 2008, both in the hospital and in the clinic.
Okay, wonderful. Thank you. And thank you for being here. So the first question I have, we're going to be talking about the measles outbreak and being in kind of that area where the outbreak was really kind of centered. I know you have gained a lot of experience in understanding measles and also being able to diagnose it. And so can you just tell us a little bit about your experience and how it has been for your community that you serve in West Texas?
Right. So truthfully, I don't think I ever would have guessed that I would have had to diagnose measles. And I was quite shocked the day that we found it in a patient. She had been in the hospital for just a normal, uncomplicated delivery. She did not have any signs of measles when she had been in the clinic earlier that week. She didn't have any signs of anything when she came in and was admitted. We knew that she was not vaccinated, and she had been in the area that was most affected and exposed. Potentially, but she had been exposed for, several weeks to various people. So that was not something on the top of our minds. But we went in the next morning after she had delivered for postpartum rounding, and she just mentioned that she just couldn't get enough blankets. She thought she was having some kind of allergic reaction to something because she's just itching all over, and she just didn't feel well. And by the time we got into a full exam and had seen, got all the lights up where we could see what was going on, it was very clear that she had a classic measles rash and had been feverish and coughing. And these symptoms, for the most part, started right after she had the baby. Okay. So at that point, she had been around lots of people in the hospital. Lots.
Yeah. And we know that measles is incredibly infectious. And so I can understand the concern that probably erupted, not only within that room and the concern for baby, but also for all of the possible contacts that happened.
Exactly.
I know you had mentioned previously the concern about the air filtration system, the importance of isolation, and also the potential for other babies to be infected, right, given the way that the nursery is kind of set up. Can you tell us a little bit more about that?
So the day just everything kind of went a little bit crazy after we realized what was going on, but we did fortunately have an isolation room available. She got moved to that along with her baby and her family. And then we started getting the hospital administration involved, and they started contacting, of course, the health department and all the things. It was a challenge to figure out even how to get the test done, sent off, because it wasn't needed routinely, especially in that particular part of the hospital. So there was various challenges with that. And by the end of the day, from what I had been told, stuff that I wasn't directly involved with, but the staff from the CDC had come to help and assess the situation. And somehow in that process, they figured out that the air conditioning vents and the ventilation system from the labor and delivery to the NICU, which are on the same floor, were connected. I don't, know how those things get decided when you build a building, but that wasn't considered at the time. And so they were able to fix that by the end of the day and come up with some kind of a temporary solution to disconnect that so that no further exposure happened to any new babies that were admitted to the NICU. And then they started just ramping up some more temporary setups for reverse or negative pressure, rather, isolation rooms, so that if there's more cases, we have more options for that.
Yeah. And did you end up seeing more cases, even within your patient population outside of this particular one in the hospital?
I had 2 patients personally. There was one prior to this who had a mild active infection at the same time that her kids did, but she had been vaccinated as a child, and so she wasn't terribly sick. She barely missed the window. Like when she came into our clinic visit, she was just past the time she should have been quarantining, and so that was like a kind of an initial close call.
Yeah.
But this one affected a lot more people.
Yeah, absolutely. And I know you already mentioned this a little bit, but kind of being able to have the public health institutions kind of get on board pretty quickly, it seems like it happened well. Were there any speed bumps that you noticed? This might be something that you weren't maybe intimately involved with, but did things happen fairly smoothly as far as what you could see? And were there any things that, you know, you thought were interesting or useful to know?
As far as how the hospital handled everything following this. Sorry, I
Yeah,
kind of
and
missed the first earlier part of the question, but
you're good.
um
Yeah, and
uh
also working with like the reporting systems, the local jurisdiction, the even CDC when they were coming in. Like it didn't was
yeah, I wasn't directly involved with any of that part of it. I was in involved with just the patient, like helping her decide if she was going to give her baby the immunoglobulin, and then of course all the other babies on in the nursery and the NICU all had to have that as well, and then they
right,
had to revamp the whole NICU setup to isolate all of those babies from any new ones that were going to come into the unit
right,
following. Um,
right.
but yeah, as far as that reporting, that happened on a different level.
Level. Okay, perfect. And then what were some, I know I asked you this previously too, but what are
You're
some
good.
lessons learned that you feel like were useful, if, you know, kind of in
Yeah, so
future outbreaks? Yeah.
the things that changed from that point going forward for us on the clinic level, we started going through all of our current pregnant population and finding out who had vaccine records,
Hmm.
like and documenting that. We went ahead and did titers on people that didn't have records. Just, I mean, not that that's like a perfect solution, but
Right.
it at least gave us some information on who was immune.
At risk. Right.
Right. And so the plan going forward was to start taking the patients that lived in those particular counties for the hospital side of it. And if they didn't have current documentation of their vaccine status,
Hmm.
then they would be put into an isolation room initially on the time that they came in, like from the very first part of their admission.
Yeah.
Since this you kind of snuck up on us, since it was someone who had no symptoms at the beginning.
Right. Right. And how was kind of the community in terms of being receptive to these measures? Were there folks that were like willing to get the vaccine and kind of on board, or were there some people that were like, I don't want the vaccine, but I'm willing to do the isolation and all of the, you know, kind of necessary measures from a public health standpoint?
The I'm gonna say that it has not changed all that much. Like the people that have wanted to be vaccinated are people that wanted to make sure, like that probably were already vaccinated or already immune, you know, based on their age, but just wanted to really make sure they were protected. And those are people that you don't have to like convince. And the people that
Hmm.
didn't want the vaccine in the first place were, I think it's like they've doubled down almost.
Wow.
Yeah, and
Okay.
I really don't, from what I saw and what I heard, especially out there in the Seminole area, they had the health department set up for vaccinations, for testing, and that didn't have any like they didn't have a lot of turnout for that. Very little turnout for that.
I see. Okay.
What they did have was the physician that came out to do some of his work out there. I mean, that does more holistic, natural, like non-vaccine related things.
Hmm.
That was very popular.
I
Very,
see.
very popular. So yeah, I don't I it's not a phenomenon I can explain by any means, but
Yeah. Well, and I think it's unfortunately probably not super surprising to us given what we saw after the COVID pandemic, which, you know, we're
yeah,
still seeing. But you know, during the height of it, I think we expected vaccines to be something that people would be even more on board with. And we
yeah,
didn't quite see that kind of turn
it
out.
did.
So yeah, no, that makes, I mean, it's, I guess it's not super surprising, but it is very interesting to hear, especially in this very like kind of small area.
Right.
Um, the last question I have for you were, it's kind of, I think you probably already answered this a little bit, but given that this conference and that this membership is largely OBGYNs that are interested in infectious disease clinically, and then also health scientists and researchers, what is something like a gap or some question that you think would have been helpful for folks to be studying or looking at? You know, even though we're unfortunately not seeing a lot of research funding these days. But if there are people that are doing this work, what was something that kind of maybe you would want to ask for if you could from this type of community?
As far as like researching how to improve the rates of vaccination.
Potentially. I think that would be, that's one question I think that's constantly being looked at. I know there's usually focus groups that tend to look at those and see kind of the themes that come out. But given that you were in this space where there was a recent outbreak, was there anything that was a glaring kind of gap beyond what we know about kind of low rates of vaccination that you think could be useful as we move forward in the future? Because unfortunately, we're likely to see some outbreaks again in the future, whether it's measles or some other type of
Right. Right.
vaccine.
We look at like everybody's rubella status before every pregnancy, and that I know is related more to the effects on the fetus in development and all those things. But it's not routine, of course, and I don't know that it needs to be routine to test for measles immunity, but that is something that was I guess kind of interesting to see. I guess what I would say is what I learned through doing some of those titers is that you see a lot of people who don't show immunity, which I know doesn't necessarily like that they still could have immunity even without
Right.
that. But knowing that ahead of time and using that as an ability to get more people vaccinated, that would be good. But I think, I mean, closing the gaps between just the trust of the system, that's to me the hugest thing I see out here right now is that people do not trust anything they consider to be, the system.
Right.
Whether it's pharmaceutical companies, it's government agencies, it's just medicine in general. That is
Yeah,
the biggest challenge out here right now.
I agree. And I think just based on what you were talking about, the kind of one trusted physician being someone, I don't know if that physician was uh, doesn't necessarily recommend vaccination, if that's their stance. But I think sometimes when you have that influential person in the community, that if you can get the buy-in from them, I think it can mean a lot. But obviously, if you don't, then it can really kind of tip the scale in the other direction. So that does sound like something unfortunately that we're going to have to keep working against. But I don't have any other questions for you. I don't want to take up too much more of your time. But anything else you want to note? Anything I didn't ask you?
No, I think that pretty well covers it and sums it up. But yeah, for providers just to keep building those relationships with the patients and to find some kind of way to be able to help people sort through information online, particularly, and understanding what good solid research is and what things in studies are not valid and not good to rely on. That's a hard thing for patients. I mean, they're relying more on Facebook groups than they are on actual studies.
Yes, unfortunately. And I think
what I do.
I agree. And I think there's a concern about transparency. I think there's a concern about how the science is being conducted, and how that's, if that's in any way digestible to the lay community. So I think that there is still work to be done in that arena for sure.
For sure.
But thank you so much for speaking with me.
Yeah, absolutely. I appreciate the opportunity. Have a really good day.
Thank you. You too.
Cool.
All right. Bye.